Good morning, everybody. Today is September 6th. Happy Labor Day. Dr. Vuong here with your COVID update. You know, one of the things that's alarming is that a lot of states and counties are not reporting their numbers anymore or slow reporting them. So it's less accurate of a picture. But overall, I will tell you that the South is still really high in cases. Maybe they're plateauing a little bit here, but states like Mississippi, Florida, I mean, the hospitals are full, and it's making its way up the East Coast. Tennessee, Kentucky's in trouble. South Carolina is actually the hottest spot in the United States right now, but it's got to make its way up to Pennsylvania, New Jersey, New York City. So we're averaging around 161,000 cases a day, and like new cases every day in the United States. It's really crazy, and these hospital beds are getting overwhelmed. And what I wanted to talk about today was, thoughts and prayers for our healthcare workers right now, our nurses, our doctors. There was I can't remember, an article on a doctor who has worked 365 days without a day off, like he's not taking any time off at all, which I think is pretty stinking crazy. But you have to think about, a lot of our nurses, techs, respiratory techs, lab girls, even the office staff, the front desk people, they are getting burnt out. They're getting burnt out. I mean, you can only have so much compassion, especially when the majority of people going to the emergency rooms, 95% of them are, unvaccinated. And it's hard to put your feelings aside and say, why didn't you get vaccinated? At that point, it's too late. It's like a little kid who spills his milk or spills his cereal and said, well, why did you do that? Why didn't you do that? Why didn't you set it down like I told you to? Or it just doesn't help at the moment because, they're suffering. And that's where a lot of the training of medicine kicks in that average people don't realize. We spend so much time in medical school and residency really trying to hone our skills of compassion and empathy so that we can care for patients during their darkest times. And that training has really been put to the test during this pandemic, mostly because the polarity of the whole masking, vaccination, it's been really politicized. There's a ton of misinformation, and it's so bizarre if the people who are anti-vax or deniers or who think it's not that important, or they think you just need to focus on your vitamin D and zinc, or run and get some daily dosing of ivermectin, and it's bizarre to me. Why would there be this conspiracy theory, we all want to get back to a normal life. We all want to get back to going back to restaurants and baseball games and all the things that we love to do. But we got to get past this whole debate. Now, I'm going to tell you guys, everything we experienced last year was one surge. I know I went back and looked at the graph and people are like, here's the little first surge, second, third, fourth, and this is the fifth surge. I'm like, no, everything last year, when this is all said and done and you can really back away, you're not going to notice those little ups and downs we went through last year. It's all going to be one big up, and this is the second big up. And the second big up is always the big up. This is going to go bad, guys. Because if you think about it, this time last year, we were around 30,000 cases. We're heading down. That was the 7-day average. And now we're at 160,000 cases, the same point where we were last year at 30,000 cases a day going down. And I'm just talking about America. And now we're at 161,000 cases, maybe plateaued, probably going up. But let's say we follow what happens in England. We might go back down to 140 before the next surge of the holidays of Thanksgiving and Christmas. I mean, this is going to be horrible. And you're talking about medical personnel that have been battling this now for a year and a half and working nonstop and putting themselves at risk. I mean, emotionally burnt out, tired, exhausted, and short-staffed. Don't forget short-staffed, because even if they're not quitting, they're out sick with COVID. they can catch it too. They have breakthrough cases also. Now they have, they have some good protection from being vaccinated, but they can have breakthrough cases also. So I think the second, and I'm calling it the second wave. This is the second wave. It's going to be pretty awful. You have to remember, back in beginning of July, end of June, beginning July, I looked this up because I can't believe from July and August, so 2 months, we went from like 5,000-6,000 cases a day in the United States up to 190,000-200,000 cases a day. We had 191,000 cases a few days ago. So to go from 4,000 or 5,000 cases up to 191,000 cases a day in 2 months is unbelievable. And the people who sit there and comment on my fan page and say stuff like, who cares about cases? Cases don't matter. It's deaths that matter. Like, are you stupid or something? The more cases you have, the more likely you're going to have deaths. So they're correlated. So what's wrong with you? You have more cases, then you'll get more hospitalizations, then you'll get more deaths. So I do care how many cases, and especially now. Then people go, yeah, but some of these people aren't showing up in the hospital, so they make it a lot worse. Like, how many? These deniers who go, but it's not that bad because millions of people are staying at home with symptoms. Really? Where did you get that number? How do you know? How do you know so many people are staying at home? See, it's made up. Dude, you can only go by the numbers that are reported. And the more reporting and testing and things that we do, the better data, the clearer the picture gets. That's called science. That's what we do. We don't make assumptions. We don't assume that millions of people are staying home with COVID. Like, I don't know that number. It could be. It's possible, I guess. But more than likely than not, I would stick with the numbers that are reported and not use it as an excuse to not do the right thing, which is to get vaccinated. That's the best way to protect yourself. And if you don't want to get vaccinated for whatever reason, at least have the decency to wear a mask and social distance. And it's layers of protection. You have seatbelts and you have airbags. When we started, I remember I was in middle school and they started mandating seatbelt laws. I was probably in middle school. And there was all this debate and controversy about it. And now we all fucking wear seatbelts. And then I remembered they introduced airbags. And at first it was just the ones in the steering wheel that would blow up in your face. And now they've got airbags on the side, back, and everywhere. And people would report like, oh my God, my airbags went off. Look at my steering wheel. It's all blown to bits. The whole dash, the interior's all blown up and everything like that. Yeah, but you're alive, aren't you? But you're alive. And now we don't think about it. Now it's like a bragging point. Hey, this has 9 airbags or 10 airbags or 12 airbags or whatever. It's got passenger airbags and side airbags. And people, and we don't go, hey, I'll take the car with airbags, but no seatbelts. Like, no, you get both. So it's layers of protection. I mean, it's a condom and birth control pills. You can't take both. You know that, right? Like birth control pills are not 100% effective, 97% effective. Condoms are lower than that. But, birth control pills do not protect people against STDs. I used to have to remind people like this in med school. I thought it was really weird. People would say, well, I'm on birth control pill. I'm like, that doesn't protect you against STDs. So you want a little bit of both. You want vaccination and you want to wear a mask. And remember, like the regular 3-ply surgical masks are great from keeping you from spreading it. But if you want to increase your chance of not catching it yourself, you got to upgrade to an N95 mask. They're not that expensive. They're readily available now. And then it's called mitigation. Then you decide, like I did, like don't do indoor dining. Don't go to the museums. We stopped going to indoor museums. We've stopped my 5-year-old from having swim lessons because it's indoors, it's in an indoor heated pool. Like, just try to avoid where there are lots of crowds. Like, we don't go to places where there are lots of gatherings, whether it's a baseball game or a protest or a rally. Like, all right, y'all go do that. I ain't doing that, because I am adding my layers of protection. Because at the end of the day, our kind, compassionate healthcare workers, man, they're getting burnt out, and we're not even to the next big surge, man. This is just the start of the second surge. Depending on what happens, whether people, and I know, people are gonna fucking travel, and so this fall and winter, I'm not very hopeful, man. I'm not very hopeful. So get vaccinated if you start having symptoms. Oh, the other thing that has popped up on my fan page lately, and talking with other people, there's a treatment. If you catch COVID, you start having symptoms, especially early, there is a treatment. It's called monoclonal antibodies. That's what they gave President Trump a year ago. As this data came in, we started to understand that it's better to get monoclonal antibodies early, not late. We were saving them late for ICU people, which makes sense now. If you look back, they're too sick at that point. You want the antibodies to fight off the infection before your system's overwhelmed. So if you start having symptoms early on, and it's not a substitute for vaccination, but it's a treatment. It will help you get over it. Think of it like antibiotics. It's not antibiotics. I mean, I'm not saying it's antibiotics, but if you start getting sick, like pneumonia, your doctors will give you an antibiotics. If you have a sinus infection, if you have a cut on your finger and it's starting to get infected, your doctor might give you antibiotics. It's a treatment. So monoclonal antibodies is a treatment if you come down with COVID, and it's available now. Usually near you or in a hospital setting. They have outpatient clinics. Florida has mobile monoclonal antibody clinics. So I was kind of surprised that people don't realize that there's an actual treatment if you catch it. So anyway, that's my public service announcement. Prayers and wishes again go out to our healthcare workers who are working today. They are working today on Labor Day, a holiday in the United States. All right. I'll be back tomorrow with another update.